right. Once again, good morning, everybody. My name is Leanne Foster, and I am a provider outreach and education specialist here at WPS. And once again, I'd like to welcome everybody to our webinar on completing the CMS 855B provider enrollment application. Just a little bit of housekeeping. So materials for today's event are available on our training center page. They're available on our live events page, which is the same place that you registered for the event today. I have asked Ashley to put that information into the chat in case you have not downloaded those materials and would like to. It's not a requirement for you to download those materials to participate in today's event. However, you may prefer to have that just to follow along. Once you get in there, you will see the link to today's event. You'll click on the training materials link, and that will download the presentation for today's events, which are the training materials that are being shared. Questions for today's event are going to be handled through the chat feature. As I mentioned, Ashley will be assisting me with monitoring those, and I will be checking in with her towards the end of the presentation a couple of times. I encourage questions. Please make this session your own. I'll be answering your questions along with some pre-submitted questions that were received during the registration process. So thank you to those that submitted those in advance. But certainly don't feel like you have to wait until I check in with Ashley to answer those questions. Feel free to throw those in the chat as you have them. If for some reason we have more questions than time allows for today, I will be sending out the answers to those in a follow-up document to all attendees for today. Lastly, we will be providing you with an opportunity to provide your input on today's session. Your opinion matters to us. It is what steers our educational offerings, and it also helps us improve the educational offerings that we currently have. So during today's session and towards the end, you will have an opportunity to provide that input and that feedback to us through a brief survey. So if you would take a few minutes to offer that feedback to us today, I'd certainly appreciate that. Again, CMS and WPS, we do look at all of that and we utilize that in steering the educational offerings that we have. This is our disclaimer. So the material presented today is accurate as of today. As you all know, if you've worked with Medicare for any period of time, Medicare rules and regulations change and typically change often. So you'll want to make sure that you're continuing to monitor any CMS communications, which includes the WPS website, just to make sure that you are following all current CMS rules and regulations. Also, CMS does prohibit the screenshotting, photographing, or recording for profit-making purposes. As I mentioned, our session today will be recorded and will be placed on our Encore page on our website, where it'll be available for 60 to 90 days for you to view without having to access a YouTube channel, because we understand you may not be able to do that while you're at work or on your work equipment. I've asked Ashley to also place a link to our YouTube playlist, and it will be on our YouTube channel indefinitely as long as the information is relevant and accurate. This recording is going to allow you to view this again if you have any questions, maybe missed something, just want to see something again. Also, I encourage you to share this with others that maybe were not able to attend today but might find this useful. Okay, all that brings us to our agenda and objective for today. So the purpose of today's session on the CMS 855B is to provide a better understanding of completion requirements for that CMS 855B enrollment application. And we're going to talk about completion of the CMS 855B application, and we're going to talk about it from the perspective of both the paper and the electronic application. As we go through the sections, I'm going to show you a side-by-side comparison because both the paper and the electronic application do request the same information. The formatting just looks a little bit different. Sometimes the order is just a little bit different, but the two do align as far as what information they're asking and trying to capture. We'll also spend a little time talking about supporting documentation requirements for the CMS 855B. This can vary by provider. However, there are some that are typical of all submissions of the 855B, or depending on the scenario again and whether the provider is new or established, and we'll talk about those today. I also want to provide you with some common development reasons for the CMS 855B. Typically, we are developing for the same thing, not exactly, but same categories of items in our development letters. And the hope is that we will help you avoid those when you're submitting your CMS 855B. As with everything in our lives, Medicare and provider enrollment are not without their acronyms. There are a handful of them that I will be utilizing today, and I've provided those in your materials so that you have them. Not going to go through them, but they're here if you need them. So we'll start with an overview of the CMS 855B. So it's the 855B, and the B is just as it sounds. The 855B is going to be for a business. So we're talking about group clinics, so a medical clinic. We're talking about suppliers, which could be an ambulance service provider. It could be a portable x-ray, and other organizations. So you could see situations where there's an IDTF or an independent diagnostic testing facility. So if it is a business, whether it has employees or members, also known as reassignments, which we'll talk about later on today, it will ask for and incorporate all of the questions that are needed to set up that type of structure. You will not use the CMS 855B to enroll individuals, with the exception of reassignments. And again, we'll talk about that later on in the session, but this is going to be for those organizational of those business structures and setting them up with their provider transaction access number, also known as that PTAN. So what types of applications can come in with an 855B? Well, first and foremost is going to be an initial enrollment. And an initial enrollment is a provider who is new to, or an organization that is new to Medicare, could be new to our jurisdictional state. Providers do need to submit this for each jurisdictional state that they are going to be uh, rendering services in, regardless of the MAC that oversees those. And I'll say that as an example for WPS, we have jurisdictions 8 and jurisdictions 5. For jurisdiction 8, we have Michigan and Indiana. If you have a provider who needs to enroll in both Michigan and Indiana, they are going to have to submit to CMS 855B applications. And that has to do with how our claims system is set up along with our enrollment system. And they do have to compartmentalize those states, again, to make sure that claims process and adjudicate correctly. Also, you'll use this to revalidate. Now, we did receive a pre-submitted question about re-enrollment, also known as revalidation, and how often that happens. So revalidation is when an enrolled provider that's active needs to revalidate or reconfirm all of the information on our enrollment record. That is typically something that happens every 5 years. And we do offer education on our YouTube channel, which is through that link that Ashley sent out just minutes ago, that does offer information specific to the revalidation process if you're interested in more information there. But a revalidation typically is every 5 years, but CMS can actually request off-cycle revalidations if needed. An example of that is on our Part A side. We do have some skilled nursing facilities that are needing to revalidate because of some reporting changes. So you will receive a letter in either case, and also that YouTube will provide some information on how else to identify when it's time for you to revalidate. CMS 855B is also used to change information. So think name changes, provided the tax ID hasn't changed. If the tax ID has changed, that's an initial enrollment. Practice location information. From an electronic 855B perspective, again, I'm going to mention reassignments. That is something that can be changed using that 855B, and we'll talk about that. And then finally, the other application type that we see are deactivations. So perhaps there's been a tax identification change and they've enrolled the new tax ID. They now need to deactivate the previous tax ID. Or perhaps a group or an office has closed that does need to be deactivated, and that also comes in through the 855B. For all of these, there are going to be slight changes based on what you're trying to accomplish as far as sections that need to be completed in the application, and we'll talk about that. We'll walk you through that. So your submission options for the CMS 855B and all CMS 855 forms are between submitting electronically, which is the provider enrollment chain and ownership system, also known as PACOS, and the paper CMS 855B. For both of these, I have included links both to the PACOS system and to the PDF template that we refer to as the paper 855B. Submission-wise, I will always lobby and encourage you to submit electronically versus paper. Now, both will allow you to complete information through your computer. The paper version is a PDF template, so you do key that information and it asks for the same information. The difference really comes to submission and processing time. So with PACOS, you're submitting and signing. You can sign electronically, you can upload documents. That comes in, and our processing time, if no further development is needed for missing or unclear information, the processing time is 15 calendar days. Because we can leverage some automations, your information is already in the enrollment system, and so we don't have to do as much manual manipulation of that information as far as data entry and ingesting it into our system. It's all electronic. A lot of automations are in place. With a paper application, once you fill that out through that template, you do have to print that. You then have to get that to us through regular mail. It cannot be faxed. It cannot be emailed. The only electronic option for submitting that application, and this is per CMS, is through PACOS. So then it needs to be scanned into our system, ingested into our workload system, and processed. And that process, because of that manual data entry that is involved, and we do leverage automations as much as we can. However, there are some verifications that have to happen manually. It just takes a little bit more time. So that paper application, if no further development is needed, that processing time is 30 calendar days. So it's about twice as long. Also, when it comes time to make a change or revalidate, the PACOS submission is going to allow you to view all finalized enrollment data as we have it in your system, and you will have access to that 24/7 by accessing PACOS. With a paper application, you'd have to call, ask questions. You really don't have that line of sight into your enrollment data. And again, then with changes and revalidations, you can see what needs to be changed or adjusted and do your submission electronically. So I'll always encourage you to check out our electronic systems. And we do have some, it just recently did actually a webinar on how to sign up for PACOS and some basics inside the PACOS system, including starting various application types. That is available on our YouTube channel. Actually, both of those are available on our Encore presentation page in our training center as well, if you'd like to take a look at that for more information. So we're going to get started with a section by section comparison, and we're going to talk about the information that is required for each section to help you complete that CMS 855B. I am going to show you a side-by-side between PACOS, which you're seeing here on the left, and the paper application, which you're seeing on the right. And it'll pretty much continue that layout going through so that you can see where the information would be requested in PACOS versus that paper application, and so that you can see the similarity in those questions. So we'll start with section 1A, which is your basic information section. Now this is going to be a little different, obviously, between paper and PACOS. So in PACOS, what you're looking at on the left side is a questionnaire. We refer to that as the enrollment questionnaire. And with PACOS, it's going to be asking you multiple questions. It's a lot like the do-it-yourself tax software. It asks you a lot of questions so that it knows what information to gain from you. So PACOS will do the same thing, and it'll essentially, I refer to it as bolt together the topics or the required sections for the type of provider that you are, because some sections are only required for certain provider types, but also the type of application that you're wanting to submit. So section 1A on the paper application, very much the same, except it's going to start out by asking you, what are you trying to accomplish? Is it an initial enrollment? Is it a revalidation? Is it a change? And you'll select the box And with PACOS, it's going to bolt together your topics. On the paper application, you'll see in a yellow box on the right side of that paper application image, a list of sections. And this is how the paper application tells you which sections apply. One of the things with the paper applications, you'll see a lot of, especially for initials and revals, submit all applicable sections. And based on how you answer questions, it may take you to a different or ask for additional questions and take you to a different section. PACOS does the same thing, except it eliminates all of the things that don't apply to you. It already knows which sections to attach as you answer questions inside of it. So this is an example of those additional questions. So if you're making a change of information, there are going to be some additional information. Now, PACOS is going to ask if you're deactivating, if you're an initial, if you're doing a change. So it gets more specific on the type. The previous slide, it was asking more about the provider type. Slight difference, but it's getting to the same point. The paper application does have 3 pages where you're going to indicate the types of information that you're changing. And again, you'll see in that gold or yellow box on the right of that paper image, it's going to show you the section specific to that change. One thing I do want to call out, you can make multiple changes on a CMS 855 application, either electronic or paper. On paper, it can get a little confusing though, because it might list similar sections for multiple changes. If you're making multiple and they all have a section in common, say for instance, they all want you to fill out section 2A, you only have to fill it out the one time. You basically will kind of collate the list of sections and fill each section out. That's needed to accomplish multiple changes. But it will identify the required changes. And again, PACOS, as you go through, is going to bolt together the topics that you need. With PACOS, however, once you get into a change, it's going to let you make changes just to the topics as you go. Section 2A is identifying information. So for the CMS 855B, we are asking about business information. So things like the legal business name, the provider's tax ID, is there a doing business as name? What is the business structure for that entity? Is it a corporation? Is it a limited liability company? Is it a partnership? Typically, we don't see sole proprietors here, but that is an option depending upon how that sole proprietorship is set up. Typically, we see those on a different application, but it is an option here. And you'll see on the left where PACOS is asking the same question. Now, one thing I want to point out, I did not show you all of the pages in PACOS, and it gives them to you in order. And this is just the first page. It'll ask for names. And one thing you'll notice is that some sections are grayed out. They're ghosted out or grayed out at this point until you answer a question in a way that's going to require that section. So again, that's how PACOS is telling you and bolting together just those fields, just those questions that are required. Whereas in the paper application, you will have to read through all of that. Both, again, are absolutely acceptable. You can submit either way. There's just some differences in them. The other thing that Section 2A will ask is about license or certification information, and that is if you're licensed by the state or if you have some type of national certification or even a state certification in order for that type of business to practice. It's not the licensure information for the individuals. The one license that we'll typically see has to do with if we have portable x-ray companies, ambulance services. The other one would be a business license to operate. That's not required by all municipalities, but if one is there, we do need a copy of that. Section 2A continues on a second page, and we are running through here the correspondence and medical records correspondence address information. And again, PACOS is going to allow you to add information, and then it'll ask you if the correspondence and the medical records correspondence are the same, then it's not going to make you add it twice. Neither will the paper application. There are checkboxes for that. But we're asking for that certification. We're asking for the correspondence address. And this address does need to be an address where if in 5 years when you're asked for a revalidation, if a letter is sent out, you do need to have that correspondence up to date because that is where that information goes. There's also other claims correspondence that goes to that address, so it's super important that that is a valid address. And the one thing that you will notice is that it cannot be the billing agency address or a medical management company. It does need to be for that provider specific. Section 2B and 2C. So this is going to be your provider type, essentially the specialty for this entity. So if it's an ambulance company, you would check ambulance company. If it's a multi-specialty group clinic, you would indicate that it is a group clinic. You could be a pharmacy, it could be an opioid treatment facility. There's a lot of different types of organizations that can enroll, and there is an other. However, and this is true of PACOS as well, though PACOS has already asked this question, what you're seeing here is the supplier type based off of that initial questionnaire. One thing I do want to point out with that supplier type in PACOS, once that's selected and you answer those questions, you are going to get a scenario box that's going to ask you to confirm this is indeed what you're trying to do and the type of provider that you are. Take close close look at that if you are submitting electronically, because that can't be changed when you get to this point. The application would have to be deleted and restarted. This is also where if you have a hospital where the departments within the hospital are going to enroll separately, we do have a section where we're asking for the department and their identification number and their MPI. That's not something that's really common anymore, but it is something that would be reported on that 855B. A lot of our hospitals are enrolling in the Part A side, or they're enrolling as a group clinic if they have an outpatient. Next few sections are sections 2D, 2E, and 2F. And you're seeing me combine these because they're basic questions that you're going to ask for, or that we're going to ask for. Now, this is for physical therapy only. And in PACOS, if you're not setting up as a physical therapy group, specifically, now this is different than a multi-clinic that has physical therapists. This would be a physical therapy group that is owned by physical therapists and is just encompasses a physical therapist. So it's a little bit different. It's practicing independently. Um, this question only shows up in PACOS if you make that selection. Doesn't show up for multi-group clinics. But this is going to be asking questions about those PT and OT groups, and it's being used to establish their independence. So it asks about where their practice is, if they have private office space, if they lease their space, if they're seeing patients in their home. It's a series of yes or no questions. It'll also, for other providers, will ask for accreditation if it's needed. This is typically going to be our ambulatory surgical centers, or our ASCs. And then if you have physician assistants, organizations have some control over their reassignments. Now, this has changed. This section does still exist for physician assistants, because physician assistants now can do a typical reassignment versus being set up as having an employer. Essentially, they were always the same thing, and now CMS has simplified that. But that is just for termination, again, allowing those groups to manipulate those reassignments on behalf of their members. Section 3 is going to be the adverse legal action, and this is of the entity that is enrolling. So Section 2A, so the clinic, the supplier, the organization that is enrolling, we need to know if they have any adverse legal actions. Those actions and the timelines. So for instance, if there's a felony that's been committed by that entity in the last 10 years, that's an example of a timeline that you'll see in the instructions. And I'm not going to go through all of the different adverse legal actions that need to be reported. It is misdemeanors and felonies, typically healthcare or financially related, but a listing of those is included in the instructions of the application for both the electronic and the paper version. If you answer no, you simply answer no and move on in both instances. If you answer yes, we do need supporting documentation for that adverse legal action. Having an adverse legal action does not preclude the provider from enrolling in the Medicare program, but CMS needs to know about it, and the MAC may need to confer with CMS to determine the risk that is posed. This is a big part of fraud prevention. The best way to protect that Medicare trust fund is to keep those who would do harm to it from obtaining access to Medicare funds in the first place. So that's a big piece of what we're looking for here. The documentation would have to be court documentation and resolution documentation. And I say court documentation, it has to be official. It doesn't have to be the original, but we do need to see something from the court or the entity that took the action, not a letter from the provider or something simply a letter from the attorney that may have been involved. We do need the actual adverse legal action documentation. Section 4A is practice location information. So this is where services are being provided. So physical locations, where you're seeing patients. That could be something that maybe there's an office in a strip mall. Maybe it's a suite in an office building. It could be any other medical facility. Maybe the provider does outpatient services at a hospital's outpatient clinic and they have an address there. We need to have that. These go on file and are a big piece of adjudicating a claim because fee localities and pricing and fee levels are based off of those practice locations or partially based on those locations. And so if that location's not reported, comes in on a claim, it is going to cause a denial and you want to avoid that. Physical locations, one thing I do want to mention is you do also want to remember medical facilities are not considered a patient's home, even if they are domiciled there. So for instance, a nursing facility, a skilled nursing facility, or an assisted living facility, those are not considered the patient's home. So the patient's home is more like they're living independently in an apartment, they're living in their house, what have you, but not a medical facility. Again, even if they are permanently domiciled there. If you are doing telehealth, that's a big topic these days, and your entity doesn't have any physical locations, that is possible, but we are going to need an administrative location for telehealth. And both the paper and the electronic version of the form will allow for you to indicate that that is what that is. And that's kind of important, especially if it's a provider's home address. We don't want that to be listed on our compare list that goes out for beneficiaries. That's their provider directory. We understand we don't necessarily want to publish that home address. Also for ambulance, so for suppliers, it's very much the same as I've been describing, but for ambulance services, it is where they dispatch or house their vehicles. So it could be absolutely be a garage in that case. It could be a dispatched office. That's maybe not where the vehicle is. The services are being rendered in that ambulance, but we need to know where that vehicle is being dispatched from or where it's housed. This section is also going to ask about special payments address. Now, we pay all of our providers electronically. We do not send out paper checks. However, again, there's revalidation communications that go out. There's medical review communications, claims development letters that go out that will go to these addresses outside of enrollment. And so it's critical that that address is accurate. So here again, it kind of goes across 2 pages. That's why it's here twice, but that special payments address. And also there's a medical record storage address. We talked about the medical record correspondence address, and that's more for if we need to reach out about medical records, but we also want to know where those medical records are stored. It can be a physical location. It does have to be a physical location. It cannot be simply a PO box, but it needs to be that physical location. There is a question that you can answer both on the electronic and the paper that allows you to say it's the same as the practice location. That is fine, and you do not need to provide the address again. So both have it built in where we try to simplify and eliminate you from unnecessarily needing to duplicate information. Also, this day and age, a lot of providers are storing their medical records electronic. Pretty much, personally, I don't know that I've seen a paper record in quite some time. But with the electronic records, we do need information about the vendor. We get questions about the URL. We don't need the URL. We don't need, obviously, any kind of access to that, but we want to know the vendor or the software name that's being used. Section 4D, we are again talking about patients' homes. I mentioned that as practice location. If a provider is going to be rendering services in their home, again, this is not a medical facility, not a nursing home, not an assisted living, not a skilled nursing facility. It's their apartment. It is their house, what have you. Uh, we need to know if the provider is going to be providing services in their home, which would be that place of service 12. Uh, this is also not telehealth. Telehealth is a little bit different because of the nature of how telehealth is delivered. But we need to know the city, the county, the state. It may not, it may be an entire zip code and that's all you have to list. It may be an entire city and that's all you have to list. It may be an entire county. It's going to vary. We don't need the patient's location information, but we need to know the area in which you're going to be providing those home services. Section 4E and 4F are for our mobile units. Now I want to be really clear, these are for our mobile units. So think portable x-ray. This is not going to be for an ambulance service. We'll talk about how ambulance report their vehicles later, but the two sections are not interchangeable. So you do not want to list ambulance information here, but it's asking for the type of the vehicle, the VIN number, that vehicle identification number, because we need to add that to that enrollment record. Medicare does need to know what vehicles are being utilized. And again, this is not for ambulance services, and the instructions will tell ambulance services to go to a different section. They go to the attachment, which we will talk about. Section 4G is for geographic locations served. Again, this is going to be for those mobile units. So if you have, say, a portable x-ray that's reporting vehicles, we're going to want to know their geographic location served. Again, not ambulance, that's going to be asked for in another place. But this is going to be very similar to patients' homes. We want to know what city, what county, what state, what zip code. The state, we get questions, well, I'm enrolling in, for example, Michigan. Well, the state's Michigan. Well, yes and no. What that is there for is for you to indicate whether or not you provide mobile services for the entire state, or is it just a specific geographic location, much like the home services. So we just need that information, and you can add and delete, so you can make changes and do your revalidations from here too. Sections 5A and 5B. So this is going to be organizations that have ownership or managing control in the entity that is enrolling. So it's not typically going to be the same entity. Sometimes you get into government agencies and it may appear to be the same agency, but it's not because it's the county of. But this is going to be a parent company. There will be an organizational chart that shows that parent company's oversight of the entity that is enrolling in Section 2A. This is not all that uncommon in some of the larger medical organizations, but it depends upon the entity who is enrolling that's requesting that PTAN, the entity listed in 2A. It just depends on their business structure. So you do have to report all organizations that have a direct ownership or an indirect ownership, which would mean you could have a parent company that also has a parent company. And so you'd need to list both. Again, that can get confusing, but that is where organizational structure charts of the entity that's enrolling will show that hierarchy. And we do have some information out on our website. And I'm going to take you out there. And it's under the Provider Enrollment Topic Center, but I typically just search for it. Organizational flowcharts. And I didn't include this in the links I prepared for today, but I am going to add that to the chat. Apologize if you hear me keying. But this is going to talk about those flowcharts, the applications that we may need them for, and then it's going to give you some examples. So when you're looking at this flowchart, we're basically following the line. We're looking for the entity listed in 2A and going up or sideways, however it's oriented, but we're looking for the hierarchy and anyone that is above that oversees the entity enrolling, that's what we're going to be looking for. This third one here is a really good example of something that would have a direct and indirect. So entity 4 is going to be a direct, managing your ownership of the enrolling entity. Entity 3 would be indirect, and so would 2 and 1. So that's a really good resource if you're looking at a business structure like that. Section 6A and 6B, very similar. However, now we're talking about the individual owners. Again, direct owners have direct ownership in the enrolling entity. Indirect owners could be the owners of the entities listed in section 5. So that entity has ownership in the enrolling provider, and the people that own that entity also have ownership or some type of managing control, and they need to be reported. Again, this is a fraud prevention tool, and we are trying to prohibit those that would do harm to the Medicare Trust Fund from gaining access to the funds in the first place. So we're looking for direct and indirect owners, and then managing employees. This can be a billing manager, a credentialing manager. It's not necessarily every employee that you have, but it's somebody that has direct oversight into the day-to-day operations, is going to have access to those funds. For those entities that don't have owners, this is going to include board members, directors, and officers because they have oversight of the enrolling entity. Billing agency information, this is going to be if an outside company is being used to do the billing for the enrolling entity. So this is not in-house billing. This is we contract with ABC Billing to submit all of our claims. So we do need billing agency information. We do need their legal business name, and we do require a street address because that's where the claims are coming from. So again, fraud prevention tool, we do need that street address. And as you can see, it's going to ask you a series of questions in PACOS versus on that paper application. But it is going to ask you all of the same information. Now, section 12, we're getting into supporting documentation here. At this point, we've filled out the base. There are some attachments for specific provider types that we're going to talk about in a minute, but these are the sections that are universal, that are for all of the providers. And section 12 is for supporting documentation. Now, in PACOS, it's going to look a little bit different, and we're going to talk about how we upload those documents, but PACOS is going to show you a list of documents that may be needed based on how you answered the questionnaire in the front end and how you answered other questions. For instance, if you say yes to an adverse legal action, it's going to tell you that we need those court documents. If you answer no, it's not going to ask for them because you said no. With the paper application, it's going to basically give you a checklist, and that's going to be a universal checklist on the paper application. PACOS can streamline it a little bit and isolate. PACOS may also ask you for some that may or may not be needed because they're needed if they exist. But that is what this section is. Not a required section to fill out, more of a useful checklist for you as a provider. We will not develop if you do not check the box. We're looking for the actual document. So what kind of documents are we looking for? So the documents and additional forms that we may be looking for an 855B, one, especially if you're new or if there's some kind of name change, we're always going to be looking for IRS documentation of the legal business name with the tax ID. That is because there are audits against the tax IDs and the names, and if they don't match, the IRS may require us to put a backup withholding on the claims for that provider, and we're trying to avoid that. So we have to make absolute certain that our name in PACOS is matching that the federal IRS has. And to do that is going to be through a document that comes from the IRS. The federal IRS can see our legal names. We cannot see information in the federal IRS database. We will get notifications from our PACOS system that'll tell us something doesn't match. So again, to avoid it, we get that documentation. So CP 575, 5013C status letters, 147C tax coupons, so long as they're computer generated and have the tax ID and the legal business name of the provider, it is acceptable. One Word of caution, particularly on the CP 575s. If an entity has a particularly long name, sometimes it's on a second page where it might be cut off on the main page, but the second page has the whole name. Just kind of a word of caution, because if we don't get the entire name, we will develop. As I mentioned, licenses, certifications, and accreditations. We do need copies of those. We do try to do everything we can to verify those through a publicly available source, but some of them simply do not have it. So we do ask for copies of those. If there's a vehicle involved, this would be for ambulance and just regular mobile units, we do need a copy of the vehicle registration. This is the vehicle registration that might be in the glove compartment of the vehicle. We do need a copy of that. It confirms the VIN number for us. Organizational diagrams, we just talked about a little bit. Some additional forms that might be needed. The CMS 460, which is a participation agreement, that participation agreement is if the provider wishes to be a participating provider that's accepting assignment or Medicare payment as payment in full on all claims outside of any coinsurance and deductible. It's not necessarily automatic. Enrolling and participating are two different things. Enrolling means that you are gaining a PTAN to be able to use that MPI to bill to Medicare. You do need to complete a CMS 460 in order to be a participating provider, and there's slightly higher allowable amounts, and you're not subject to a limiting charge. However, you can't charge the patient more than the outstanding coinsurance and deductible, whereas you might be able to obtain a little bit more from the beneficiary if you're not participating, but again, there's a limiting charge, so it's not just a free-for-all. You can charge whatever you want necessarily. With CMS 588 Electronic Funds Transfer Agreement, this is required for all initials and anytime banking information is changed. This sets up the electronic payment from Medicare and asks for information on the bank account, the account holder, so that we can make those payments electronically. And these are separate funds or separate forms. They are available in the same location as the CMS 855 application on CMS's website. And to get to that, I'm actually going to show you that. It is CMS's website. And what I find to be the quickest way is going under Manual Forms and Transmittals. There's a CMS form list. And when you click on that, if I type in the 460, there's a link to that form. If I go into the 588, there is a link to that form, and both forms provide instructions. We're not going through those forms field by field today, but we do have some education on our YouTube channel that does do that. All right. Those additional documentation takes you back to the form itself and section 13, which is the contact person. This is going to be a list of individuals that provider enrollment could contact if they have questions about that enrollment application. It is also the individuals that our customer service area looks for when they authenticate, when providers are calling in, to ensure that the individual calling should have access and can be spoken to about that enrollment. So you can list multiple. There's not a limit to how many that you can list, but you do need to make sure that they are here. They're also the individuals that are going to get the development letters from the enrollment process and the approval letter from the development process. I do want to point out revalidation letters are not sent out here. Those are, again, going to be correspondence, practice, and special payments if they're different from each other. Then we come to signing the application. Again, we're going to talk about a couple of attachments yet, but this is the base for everybody. So the applications all need to be signed. You can have multiple authorized officials, but it's also okay to only have one. Depends on the organization. It does need to be someone who can legally bind the organization into a contract. These enrollment applications are essentially a contract between the provider and the Medicare program, and the provider and CMS. And so it does need to be somebody that is high ranking. So we're looking for an owner, a board member, a director. So think CFO, CEO, COO. And they do need to be someone who is reported in Section 6. Again, you can have more than one. You can actually have more than the two that are allotted on the paper form. You just need to copy the page and repeat it as you would with anything else where you're reporting multiple things. And in PAYGOS, it is going to populate those that are eligible for authorized or delegated official, because you'll designate that in section 6 when you fill it out for that individual. If they're not listed in section 6, they will not be listed here, and they don't necessarily have to already be on your enrollment record. It is based on how you're filling out that application. So if you need to add one, change one. Section 15 is a delegated official. They are delegated by the authorized official, and they can do everything. They can make changes, revalidation, manage reassignments. What they can't do is be the only signature for an initial enrollment, but they can be someone such as a billing manager, an office manager. They can, like I said, make changes, reassignments. They can terminate. They do need to be added as a delegated official, and the authorized does need to sign for that designation. They also cannot be a 1099 employee, so not a contracted employee. They do need to have a direct W-2 relationship with the enrolling provider. So as I mentioned earlier, we received several questions regarding managing your reassignments, and we're talking about this here. This is something that is unique to PAYGOS. So in a paper application, providers can do some manipulation of their physician assistants, but they cannot manage their reassignments from that paper application. They would have to either submit through PAYGOS on the organization or submit a different CMS 855 application, the 855I, for that individual. So in PAYGOS, it's going to allow organizations to add, change, or remove provider data that is related to their organization. So they're reassigned. And a reassignment is when a provider is practicing in the Medicare program, they have an employer, and they're reassigning, they're submitting the claims, they're still going to get a PTAN, but when their claims are paid, it's not going to be paid to the individual directly. It's going to be paid to their employer or the group clinic, for example. And then that group clinic's going to pay that individual provider based on their employment agreement, salary, per diem, whatever it happens to be. Organizations can change that information. What they cannot do, and this is related to one of our pre-submitted questions that was asking how they work, is they cannot make changes to personal information about the provider. So they could change, maybe they could add a provider and have them reassign and get that provider a PTAN by submitting through their organization PAYGOS. They could terminate a provider that's maybe left, retired, what have you. They can do that through their organization. But if that provider's individual name changed, they'd have to submit an 855I to change that information on the individual. So they're compartmentalized. There's the provider's individual information, and then there's the reassignment information. And the organization can manipulate their specific reassignment information, not any of the other organizations that that individual may reassign to, just those that are affiliated with them. Also, we see this a lot if you have a new provider, they're wanting to add their reassignment in the organization, and technically the system will let you do that. However, if the provider is new, we still need an 855I application, so it either needs to be sent in separately, or what I would recommend is just sending in those initials through that 855I, because you take care of the reassignment there as well, and it's one application. Moving forward, you'd be able to manage that reassignment through the organization. But establishing them, PAYGOS just is not allowing organizations to go into that specific individual information through their enrollment record. So keep that in mind. Another related pre-submitted question with reassignments was asking, do you also update the group's credentialing when a new provider joins, or just list the group under the new provider's credentials? So when a provider is going to join, you're filling out, if you're doing it through the individual, you're filling out the 855I, and we're going to ask for the group that's being added. And that is all you'd need to submit. Or if the provider's established, you're going to manage the reassignment through the organization. You don't have to send in an application for the individual and the group. What happens when those applications come in we are going to be connecting that individual to that group. Okay, so it can happen on the one application. And another application that we did, or question we received related to those reassignments was asking if the provider needs to be connected by the group NPI and PTAN or just the PTAN. And the answer is similar. So when a provider is when a reassignment application is submitted, either through the individual's record or through the organization's record, we ask for the group that they're joining, and we ask for the groups PTAN and NPI. So essentially, the answer is both. However, that PTAN houses any and all NPIs that that group or organization is utilizing. And we certainly want to know all of the NPIs the provider may be affiliated with, but when we reassign that individual to that organization's PTAN, that individual is now able to bill for all addresses and NPIs that are affiliated with that PTAN. You do not need to send in applications for each one. So if that PTAN has 400 practice locations with 300 NPIs, that provider, once they get a member PTAN under that group, can see patients and bill for services at everything under that group. It cascades down. That group really drives the location and NPI information for that individual. Next, attachment 1, this is where ambulance services are going to list all of their vehicle information, their license information. Again, as we mentioned, not back in section 4, but in this attachment. This is going to be a separate topic in PACOS that only populates for ambulance services. That is also true for IDTFs. An IDTF would be an independent diagnostic testing facility, say, for example, an MRI center that is just doing those tests. We're going to ask information about their equipment, their personnel, and their procedure codes. Attachment 3 is for opioid treatment programs, and this is only opioid treatment programs. And this section asks for personnel information, personnel that are ordering and dispensing the treatment that is being utilized in that center. And again, these attachments are in addition to the base sections that we've been talking about today. And we do have separate training on all 3 of those if you're looking for something more in depth on ambulance, IDTF, or the opioid treatment center. So with that, I am going to check in with Ashley if you have any questions. I know we're running just a little tight on time, but we'll answer as many as we can.
Hi, Leanne. We did have a few questions come into the chat. And the first one is, if a provider is enrolled with one group attached as reassignment and the provider leaves the group with no other reassignment of benefits listed, is there a way to remove the reassignment of benefits without having to deactivate the provider enrollment entirely?
That is a fantastic question. It depends on how the provider is setting up. Based on the question, the provider is established with Medicare through that reassignment only. And when that's the case, they're not in a private practice or working for another clinic. The answer is unfortunately no. When we deactivate that reassignment, because that is the only PTAN that they had, it will deactivate the entire enrollment. We cannot leave an enrollment open without a PTAN. Now, if you have a provider who's leaving a group but going to another, my advice is for them to send in the deactivation and the new reassignment at the same time, because what will happen is then that new reassignment will establish a PTAN and help maintain that enrollment record. But if they don't have anything else active, it will be deactivated, and if it's 2 months or 6 months down the road, they now have a new reassignment to report or private practice, they will have to start over in the process. All right, next question.
All right, the next question is, how can I become an authorized signer? Some of the people that are no longer with our practice, and since I submit the apps, we would like for me to become an official signer.
Okay, so that would be a change application through that CMS 855B. Now, you'd certainly have to look to see if you meet the qualifications for an authorized, or do you meet the qualifications for a delegated official. Not having that information, I can't tell you which one that you would qualify for, but that is simply a change of information application, ensuring that your information is added to Section 6 for ownership or managing control, and then 15 or 16 based on which type of qualifier you have.
All right, thanks, Leanne. And it looks like we have one more. I'm not sure if this is a question or a comment, but this says, when I go on PAYGOs to add myself as official signer, I get this error. The NPI that was entered has failed verification. Please make sure that the name, social security number, national provider identifier, and date of birth match what is on file with NPES or NPPES.
Okay, so that has something to do definitely with that MPES file. You'll need to access MPES and see what information is on file. So it's saying that it doesn't match with the name that you're putting on there. Now, if it's your MPI, check MPES, see if something is not working. If it's your organization's MPI, then the question becomes, are you a provider that is capable of getting that MPI, or are you an authorized delegated official, or maybe you're submitting on behalf? That is going to be something you're going to want to go into the identity and access system to determine, to make a connection as that with that organization. And there's a lot of things that could be happening there. So I'm sorry this isn't a complete, absolute response, because again, there's a lot of components to it. But I would check your MPAS record if it's your MPI. I would check the identity and access system, and we do have education out on our YouTube that'll walk through that. A lot of good resources there, and see how you're set up. Now, if you're not a CMS system user, you don't have a user ID and password, then that tells me that that MPI might not be yours and you may be submitting on behalf. And that's definitely going to be an INA access issue where you've got to make sure that you have the connections and the authority to submit those applications. But typically a signer, it has to be the person that is signing that application's MPI. So take a look at your setup, but that's likely the issue.
All right, and that was the last question we have in the chat as of right now.
All right. I know it's 12:01. I just have a little bit. Well, want to talk about development a little bit and then wrap up. So I appreciate everybody's patience. Sorry, we're running just a little bit over. So I want to talk just a minute about some common development, the things that we see. Forgotten supporting documentation. So supporting documentation can be uploaded in PAYGOS, and it's part of that signature process. It does have to be a PDF or a TIFF file. It can't be a JPEG or a PNG. If you try to upload a JPEG or a PNG, you'll get an error, or you won't get an error and it won't upload. We need that information and we will develop for that. So I've listed a couple of the forms that are heavy hitters for being missing from that. The other one is signatures. So signing an application is a two-step process, particularly with an authorized and delegated official, as with the 855B. So if you are not the individual that is signing the application, if you're not the authorized official, you can absolutely ask the system to sign it, but it's going to send an email to the individual that needs to sign it so that they can go in and sign it. So it can take up to 3 days. Unfortunately, what happens is the application gets submitted and then that email go at the same time. And sometimes we are working on current date receipts for PAYGOs because it happens that quickly and the signature just hasn't caught up and we haven't gotten that. So that's one thing that we see. You can upload paper signatures. Electronic is definitely your best bet. We are aware of that. That is something CMS hopes to change in the future. We're just not there yet, but that's one of the things. The other thing is we don't have the right signature. If you're not listed in Section 6 or you don't meet the qualifications of an authorized or delegated official, you might be able to sign it, but we can't accept it because you don't meet those qualifications. So make sure that you're looking at that. Reassignments. If you've got a new group, we have to have at least one reassignment in order to process that group application. We can't have a group without reassignments. System won't let us do it. So that is something to keep in mind. We'll also ask about reassignments, if someone terminates a reassignment and it's the last one on the group, it's like the individual, it's going to terminate the group. So those are things that we'll ask about. Or we don't have a correct PTAN or MPI listed on the reassignment. Something doesn't match up. So make sure that that information is there. And then that ownership information related to signatures as well. We need to have all ownership and managing control reported on the application. And when we're looking at the organizational chart, if somebody's missing, we're going to develop for that. On a revalidation, if everything that's currently on file is not accounted for, either by telling us we need to maintain that information, we need to change that information or remove it. If something's missing, we can't make assumptions that say if something's not there, it's no longer the case. It all has to be accounted for, and we will develop for that. So with that, I'm going to do one more check in with Ashley to see if we have any questions. Otherwise, we'll wrap it up.
Hi, Leanne. We have not gotten any additional questions in the chat.
All right. So I've also included some resources for you. The Program Integrity Manual, also referred to as the PIM, Chapter 10, that is the manual that oversees everything provider enrollment. There's a lot of transparency in that. It shows what we're asking of the providers, but it also shows what CMS is asking the MACs to verify and what our expectations are as well. And there's information in there specific to the 855B, including information on the individual sections. I've also included links to both PACOS and the paper CMS 855B, along with CMS's provider enrollment page. And because some suppliers that enroll on this may be asked to complete an application fee, it's not going to be your groups or clinics, but things like ambulance and portable x-ray suppliers may be asked to pay an enrollment fee depending on the application fee, or excuse me, application type. I apologize. I have included a link to that information. So wrapping up, if you are attending today for continuing education credits, we will be sending out an email in a couple of minutes that will give you your contact hours, and it'll include the date and the hour. So don't delete that if you're looking for those continuing education credits. This email can be submitted to your certification or accreditation body to get credit towards CEUs. If you didn't get it, one of two things happened. It went to your junk or your spam folder, or you attended by phone and I don't have a way to systematically verify your attendance today. Go ahead and send an email to me. It's going to be that WPS Education mailbox that Ashley's just placed in the chat. Thank you, Ashley. And you're going to send that and just let me know that, hey, I attended by phone. This is the number that I attended by. I need a certificate. I'll verify your attendance and we'll get a certificate sent out to you. If you think of any questions, I will be taking follow-up questions for the next 7 days. You can also send those to that WPS Education mailbox. In the subject line, please put completing the CMS 855B, provider enrollment, CMS 855B, something of that nature, basically the title for today. That just lets the individuals that are monitoring that mailbox know that this question needs to get to Leanne so she can get you a response, and I will be taking those. One note, if you have a question that is specific to an application that is in process and a development letter, those questions still need to go to customer service because they'll have access to that information and be able to give you advice specific to that application in process. So as I mentioned earlier, your opinion matters to us and is super important for steering our educational events and helping us improve our offerings for you. CMS and the MACs do take this very seriously, and we do actually look at all of them to determine what you'd like to see and how we can improve, as I said. So tell us what you liked. What did we do well? What would you like us to keep? What could we have done better? And also, this is an opportunity for you to provide those topics for future education. This is our open dialogue. I know we communicate a lot through chat, but this is your chance to tell us what you think and what is important to you. So I appreciate you taking a few moments to fill that out, and I look forward to seeing those comments. Now, you're going to be able to do that in a couple of ways. Ashley just put a link in the chat. Click on that. It'll take you right to that CMS Qualtrics survey. The other option is going to be a redirect. You're going to get a pop-up box. Looks like what you see here on your screen, that lower image. It's not malicious, it's not spam, it's not taking you anywhere you don't want to go. It's just letting you know that you're leaving our webinar software and you're going into our CMS Qualtrics survey. So again, I appreciate your time taking a few minutes to provide me a little bit of feedback. So with that, I did go a little bit over. I do appreciate everybody's patience and time and for sticking with us. On behalf of myself and Ashley and everyone on the WPS Provider Outreach and Education team, I'd like to thank you for your time in attending today. Everybody's super busy, so I know this time can be hard to carve out of your day, and I hope you found this useful. So with that, that is the end of today's session. You may now disconnect. Have a great day and continue to be well.